Hey, so today I'll be demonstrating some NMES on my patient here who has a ACL injury, and we're trying to re-strengthen that quad. This will be the primary indication for using NMES on this patient is that muscle strengthening and re-education. Some of the contraindications that I can be aware of are pregnancy, thrombosis, skin damage, tumors, pacemakers, any area of the body you'd probably want to avoid, so sensitive areas. With this patient, I'm not too worried. I'll assess the skin before putting the pads on, but that's about it. So I'll go ahead and get started on that. So, hey Katie, how's it going?
Good.
So we're going to be doing some NMES on your leg today, and what that is basically just a form of electrical therapy that's going to stimulate some muscles in your quads right here. And what that's going to feel like is just a small tingling at first, but we'll begin to ramp it up a little bit, and it should get to the point where it shouldn't be ever painful, but it might get a little uncomfortable and cause a muscle contraction is what's going to be our goal today. And that will get that muscle firing, and it's kind of a cool way to re-strengthen and educate your muscles and get them ready to prepare for you to do it on your own and get you back on that knee there. So.
Okay, awesome.
Cool. Looks like your skin's all good to go. I'd be aware of maybe surgery scars or any bruising or swelling in that area, but looks like it's okay right now, so I think we'll continue there. So next I will set up my parameters. Our treatment time is going to be about 10 minutes. We're looking for at least 10 contractions. I'm going to do 10 seconds on for the contraction and 30 seconds off. The type is going to be biphasic pulse current, which you want a frequency between 50 and 80 pulses per second. Looks like the machine's got that going pretty good there, so I'll leave it at that. And then a width of at least 200 microseconds to stimulate a muscle contraction. Machine's got that there again. I think these are appropriate parameters right there. So I'll place the pads and then start the machine once we've got everything set up. So, the intensity also, I'm looking for about 60 to 70% of voluntary muscle contraction, but in layman's terms to the patient, that'll just equate to a strong muscle contraction. So. All right, Katie, so as I described earlier, we're just looking for a strong muscle contraction. So I'll start very slow at first, and I'll just be turning up the intensity on this machine. Have you ever had electrical stimulation done before? So?
Yeah, I have.
Okay, so you felt it before, great. I'll make sure to go slow at first again, but since you've had it, we're just looking for muscle contraction. So once you feel like that's contracting, we'll start from there. And then what we're gonna do is, once you feel that strong contraction, I want you to try and think about firing that muscle as well, and really going with it, like if you were to kick out your leg, and just lift that heel up off the table, and when that fires, I want you to think about firing your muscle as well, and then holding that contraction for 10 seconds, and then you'll feel a 30-second break, and we'll just do that for the full 10 minutes.
Okay.
Great. So, alrighty, so let me know how that's feeling. Hopefully I can get these both in.
Yeah,
So
you're good.
they're gonna, yeah. Okay, how's that feeling, Katie?
I'm not really feeling it yet.
Okay, let me know when you feel a small tingling.
Okay, I'm starting to feel a tingle.
A little bit of tingle?
Yeah.
Okay, so shortly we should see muscle contraction start.
It's getting stronger for sure.
Okay, so now we're getting small muscle contraction. There. Is that still okay there, Katie?
Mm-hmm.
Great. Okay, you starting to feel that there?
Yeah, definitely.
Great. So I think we can start it there, and then you'll feel that turn on, and I just want you to kick your leg up, just as I described, while it's going. So try and just lift that heel up. Nice job. And relax. for 30 seconds there. Yep, and then just in the next few seconds here, you're going to feel it again, and I just want you to think about trying to lift that heel up off the table as much as you can when you feel it.
The anticipation.
Yeah. And go for it. And hold, good job. And there you go, relax. Great job. Alrighty, so now I can finish our treatment and reassess the patient. How'd everything feel?
It felt good.
Felt
Kind of.
good? Yeah, a little bit
Felt weird, but
strenuous.
That was good.
Okay, great. Looked like it went well from what I saw, and looks like the skin's doing all right there. No pain with that?
No.
Okay, great. So, awesome. We'll move on with the rest of our treatment.
Okay.